Assalamualaikum and hi everyone. Today we are going to present about the tuberculosis disease. As we know, tuberculosis disease is one of the common diseases that have affected many people in Malaysia nowadays. TB in Malaysia has estimated a significant increase of mortality rate, which is 81 cases per 100,000 people per year. TB is come from the Latin word which is tuberculum, which means a small lump or bump. In 1882, Robert Koch has discovered a bacterium that has causes tuberculosis, which is Mycobacterium tuberculosis. TB was often called as consumption due to the way it seemed to consume the patients from within.
There are several symptoms that we can detect for those who are affected by this tuberculosis disease. One of the symptoms is they will cough in around 2 weeks straight, and the worst they will cough with the blood. Other than that, they will got the fever and their body will feel chills. The symptom is they will feel the pain. They will feel pain in their chest, and also they will lose their appetite. Then lastly, they will have the night sweating, and their day will be very tiredness.
So, what is the causes of tuberculosis? Tuberculosis is caused by the bacterium Mycobacterium tuberculosis. The bacteria are transmitted airborne and can infect the lungs or other body parts. Spread occurs when an infected person releases bacteria into the air through coughing, sneezing, talking, sneezing, or even laughing. Only people with active pulmonary tuberculosis are contagious. Additionally, most people can fight off the tuberculosis bacteria. However, the bacteria will become inactive and instead causes latent tuberculosis. In this state, the person is not contagious and can't spread this disease to others.
Alright, now how can you cure these diseases? Well, if you have latent TB, you should receive preventive therapy by taking 1 daily pill of isoniazid for a duration of 6 to 9 months. This is the most common preventive therapy for latent TB diseases. Next, if you have active TB, you should receive treatment for 6 to 12 months using a mix of antibiotics. Isoniazid is the most frequently used of antibiotic with a combination of pyrazinamide, ethambutol, and rifampin. Treatment for TB takes much longer than other bacterial diseases, even though you could start feel better after weeks of taking medication. You must continue taking your medication as prescribed by the doctor. If you don't, you run the risk of getting sick again, finding it more difficult to battle the illness in the future and infecting others. Medication resistance may potentially be affected in drug-resistant TB.
So, right now, I'm pretty sure that you guys just like, how can you overcome or prevent this disease because it is too dangerous for us? Don't worry because I will tell you guys as soon as possible the ways to prevent the disease. So the first one is we can use the BCG vaccine. What is BCG? BCG is Bacillus calmette guerin. That's why they known as BCG. Then it is a live vaccine against tuberculosis. It is prepared from a strain of the weakened bovine tuberculosis bacillus. We call it as Mycobacterium bovis. This vaccine is effective in preventing TB for only 15 years. The BCG is currently the only licensed vaccine against TB and has been used since 1921. It is one of the most widely used vaccines worldwide, yet we still see around 9 million new cases of TB annually. In Malaysia, this vaccine is commonly used before we travel to another country and for the primary school student. Other than that, we can keep a clean environment. A TB is an airborne infection. The TB bacteria are released to the air when someone who is affected by TB coughs or sniffs. So we need to have a good ventilation as TB can remain suspended in the air for several hours with no ventilation. After that, we need to use natural light such as UV light because it can kill the TB bacteria. And finally, we need to maintain a good hygiene by covering your mouth and nose while coughing or sneezing. So for the last one, we need to have a high and healthy immune system to avoid this disease. So when having a healthy immune system is the best form of defense against TB. When we eat healthy foods such as fruits and vegetables, it can provide adequate vitamin to the body. And we should avoid the high fat and high cholesterol food because it is unhealthy.
Thank you for lending your ears in our presentation. Stay safe from this disease, and don't forget to subscribe, like and share.